Margaret Ellison was 67 years old, and she did everything right. She took her blood pressure pills every morning like clockwork. She never missed her arthritis medication, even on her good days. She trusted her doctors. She trusted her pharmacy. She trusted the little orange bottles lined up on her kitchen counter like good little soldiers. And then, on a Tuesday afternoon in March, she collapsed in her own kitchen. By the time the ambulance reached the hospital, her kidneys, the two fist-sized organs that had quietly filtered her blood for 67 years without a single complaint, were functioning at less than 15%. The doctors had one question for her family. What medications has she been taking? The answer was almost all of them. Common ones sitting in millions of medicine cabinets across this country right now. Ones you might be taking at this exact moment. Here's what nobody tells you after 60. Your kidneys lose roughly 1% of their filtering ability every single year, starting in your 30s. By the time you're 60, your kidneys are already running at a fraction of their original power. And that means the medications you've taken safely for decades can suddenly become dangerous, simply because your kidneys can no longer process them the way they used to. Today, we're going through 9 medications, many of them sitting in your cabinet right now, that doctors and pharmacists privately worry about far more than they let on. We'll explain exactly how each one affects your kidneys, who's most at risk, and what questions you should be asking your doctor before your next refill. I want to be completely clear before we start. This video is not telling you to stop taking any medication. Never stop a prescribed medication without talking to your doctor first. That can be just as dangerous as the risks we're about to discuss. This is about awareness, so you can have an informed conversation at your next appointment. Let's get into it. Before we go through the list, you need to understand one thing. Your kidneys after 60 are not the same kidneys you had at 30. Think of your kidneys like a water filtration system in an old house. When the pipes are new, they can handle a strong flow, push out debris, and recover quickly from a clog. But as the pipes age, that same flow that used to be harmless starts to strain the system. A blockage that would have cleared itself in your 30s might cause real damage in your 60s or 70s. That's essentially what happens to your kidneys. The blood vessels inside them, called nephrons, slowly decline in number and efficiency. Blood flow to the kidneys decreases. Your glomerular filtration rate, the number doctors use to measure how well your kidneys clean your blood, drops gradually with age, even in people who are otherwise perfectly healthy. This matters because almost every medication you take eventually passes through your kidneys to be filtered out of your body. When your kidneys are working at reduced capacity, medications can build up in your bloodstream instead of being cleared efficiently. A dose that was perfectly safe at 50 can become a slow-building risk at 65, 70, or 80, even if your doctor hasn't changed your prescription in years. This is exactly what happened to Margaret. Nobody adjusted anything. Her body simply changed underneath her medications, and nobody caught it in time. So let's talk about the 9 medications most likely to put extra strain on aging kidneys. We're starting with the one that surprises people the most because it's sitting in nearly every medicine cabinet in America: NSAIDs. That includes ibuprofen, naproxen, and other common over-the-counter pain and anti-inflammatory medications. These drugs work by blocking enzymes called COX enzymes, which reduce pain and inflammation throughout your body. The problem is, those same enzymes also help keep healthy blood flow moving into your kidneys. When you block them, you can reduce blood flow to the kidneys at the exact moment they need it most, especially if you're dehydrated, fighting an illness, or already dealing with reduced kidney function. Research has consistently linked regular NSAID use to acute kidney injury, a sudden drop in kidney function, as well as a condition called tubulointerstitial nephritis, which is inflammation of the kidney's filtering tissue. Some studies tracking older adults specifically have found that regular NSAID users had a meaningfully higher risk of developing chronic kidney disease compared to non-users. Here's what makes this one so sneaky. People don't think of ibuprofen as a real medication because you don't need a prescription for it. You take it for a headache, a sore back, arthritis pain, a strained shoulder, and you don't think twice because it's the same bottle you've used your whole life. But for someone over 60, especially with high blood pressure, diabetes, or any existing kidney concern, regular NSAID use is one of the most common preventable causes of kidney injury doctors see. The risk goes up significantly if you're also dehydrated, if you're combining NSAIDs with certain blood pressure medications, or if you're taking them daily rather than occasionally. The safer approach, according to many physicians, is to use the lowest effective dose for the shortest time possible. Stay well hydrated and talk to your doctor about alternatives like acetaminophen or non-drug pain management options if you're using NSAIDs regularly for chronic pain. Next on the list are diuretics, often called water pills, commonly prescribed for high blood pressure and heart failure. Diuretics work exactly the way they sound. They help your body get rid of excess fluid and sodium through urine. This is genuinely helpful for managing blood pressure and reducing strain on the heart. But there's a balancing act happening here that becomes harder to maintain as you age. If diuretics remove too much fluid too quickly, especially in someone whose body doesn't compensate as efficiently as it once did, it can lead to dehydration. And dehydration is one of the fastest ways to reduce blood flow to the kidneys, which can trigger acute kidney injury, sometimes within just a few days. This becomes especially risky during illness. If you're taking a diuretic and you come down with a stomach bug, the flu, or anything causing vomiting or diarrhea, you're losing fluid from two directions at once. Many emergency room visits in older adults tracing back to kidney injury start with exactly this combination: a diuretic, an illness, and not enough fluid replacement. It's also worth knowing that diuretics are very commonly combined with other blood pressure-related medications, and certain combinations can compound the risk to your kidneys, especially when paired with NSAIDs, which we just talked about. Doctors sometimes call this combination, along with ACE inhibitors, the triple whammy, because of how significantly it can affect kidney function when all three are present at once. If you're on a diuretic, the key takeaway is this: pay close attention to hydration, especially during illness or hot weather, and never assume that more water pill automatically means healthier. Your doctor needs to know immediately if you're sick, not eating, or not drinking normally. This one is going to surprise some of you, because ACE inhibitors and ARBs, angiotensin receptor blockers, are actually prescribed specifically to protect your kidneys in many cases, particularly for people with diabetes or high blood pressure. So why are they on this list? Because the same mechanism that protects your kidneys long-term can cause a short-term drop in kidney function under certain conditions, especially dehydration, a sudden drop in blood pressure, or when combined with other medications on this list, like NSAIDs or diuretics. These medications work by relaxing blood vessels and reducing the pressure inside the tiny filtering units of your kidneys. Over the long run, for many people, this reduces strain and protects kidney tissue. But if your body is already low on fluid, or if blood flow to your kidneys is already compromised for another reason, this same pressure-lowering effect can tip things into acute kidney injury. This is why doctors typically recommend regular blood tests after starting an ACE inhibitor or ARB. They're checking your creatinine and potassium levels to make sure your kidneys are responding the way they should, not the other way around. The lesson here isn't these medications are bad. For most people, they're protective, and stopping them suddenly could be far more dangerous than continuing them. The lesson is that these medications make your kidneys more sensitive to dehydration and to risky combinations with other drugs. So any illness involving vomiting, diarrhea, or reduced fluid intake needs extra attention if you're on one of these. Most people never think of antibiotics as something that could hurt their kidneys. We think of them as the medications that save us, and for the most part, that's true. But a handful of antibiotic classes carry real, well-documented kidney risk, particularly in older adults or when used for extended periods. Aminoglycoside antibiotics are one of the most well-known examples in this category. They're powerful, often used for serious infections, and they're known to be capable of damaging the kidney's filtering structures, especially with prolonged use or in people whose kidneys are already under strain. This is why these particular antibiotics are typically reserved for more serious infections and closely monitored with blood tests when they're used. Certain other antibiotic combinations have also been linked in research to increased risk of kidney injury, particularly in hospital settings, where multiple medications affecting the kidneys may be given simultaneously. This doesn't mean you should be afraid of taking antibiotics when you need them. Untreated infections carry their own very serious risks, including risks to your kidneys. What it means is that if you're prescribed an antibiotic, especially for a serious infection or for a longer course than usual, it's worth asking your doctor or pharmacist directly. Is this one of the antibiotics that affects the kidneys, and should my kidney function be monitored while I'm on it? That single question, asked at the pharmacy counter, has prevented countless complications. If you've ever taken something for chronic heartburn or acid reflux, there's a good chance you've taken a proton pump inhibitor, often known by brand names you'd recognize instantly. These are some of the most widely used medications in the world, available both by prescription and over the counter. For years, these were considered remarkably safe, especially for short-term use. But a growing body of research, including large-scale safety monitoring data published as recently as this year, has identified a connection between long-term PPI use and an increased reporting of acute kidney injury, as well as a kidney inflammation condition called tubulointerstitial nephritis. The concern isn't with someone taking a PPI for 2 weeks to deal with an ulcer or a short bout of severe heartburn. The concern is with long-term ongoing use, sometimes for years, often started for a short-term problem and simply never stopped. Because the heartburn symptoms go away and nobody revisits whether the medication is still needed. This is one of the most common medication patterns doctors see in older adults. A PPI prescribed in their 50s for a temporary issue, still being taken in their 70s, with nobody checking in on whether it's still necessary. If you've been on a PPI for more than a few months, it's worth a conversation with your doctor about whether you still need it, whether the dose can be lowered, or whether you could try an alternative for occasional symptom relief instead of daily long-term use. Statins are among the most commonly prescribed medications for older adults, used to lower cholesterol and reduce cardiovascular risk. For the vast majority of people, they're considered safe for the kidneys, and in some cases may even offer modest kidney benefits. So why mention them here at all? Because in rare cases, statins have been associated with a serious muscle breakdown condition. And when that happens, the breakdown products can overwhelm and damage the kidneys. This is uncommon, but the risk increases when statins are combined with certain other medications that affect how your body processes them, or in people with existing kidney or muscle conditions. The warning sign to watch for is unexplained muscle pain, tenderness, or weakness, especially if it's widespread rather than localized to one joint or area. This is different from ordinary aches, and if you notice it after starting or increasing a statin dose, it's worth calling your doctor rather than waiting it out. For the overwhelming majority of people on statins, this is not something to lose sleep over. But because statins are taken by so many people for so many years, even a small risk affects a large number of people in absolute terms, which is exactly why it belongs on this list. This category affects fewer people day to day, but it's important for anyone managing a chronic viral condition or taking antivirals for a herpes-related condition, shingles, or certain other infections. Some antiviral medications can form tiny crystals inside the kidneys when they're not adequately diluted by fluid in the body, which can physically block normal urine flow and irritate kidney tissue. This risk goes up significantly with dehydration. And it's part of why doctors often recommend drinking extra water around the time you take certain antivirals. Other antivirals, particularly some used long-term for chronic viral infections, are monitored regularly through blood work, specifically because of their potential effect on kidney tubule function over time. The practical takeaway here is simple. If you've been prescribed an antiviral medication, ask whether hydration matters for that particular drug, and don't skip the blood work your doctor schedules to check on your kidneys while you're taking it. Those tests aren't routine paperwork. They exist because this exact risk is well documented. This one isn't a pill you take every day, but it deserves a place on this list because so many seniors encounter it without realizing the kidney risk involved. If you've ever had a CT scan with contrast, an angiogram, or certain other imaging procedures, you've likely been given an iodine-based contrast dye to help the images show up more clearly. For most people, this is routine and well tolerated. But in people with reduced kidney function, diabetes, dehydration, or who are already over 60, contrast dye carries a real risk of triggering acute kidney injury, sometimes called contrast-induced nephropathy. The danger here is that contrast scans are often treated as quick, low-risk procedures, scheduled without much fuss, and patients are rarely warned in plain language about the kidney connection. If you're scheduled for any imaging procedure that involves contrast dye and you're over 60 or have any existing kidney, diabetes, or blood pressure concerns, it is absolutely reasonable to ask your doctor, "Do I need a kidney function test before this scan? And should I be drinking extra water before and after?" Many hospitals already do this as standard practice for higher-risk patients, but it never hurts to ask directly and make sure it's been considered in your case. This last one might be the most overlooked of all 9, because most people don't think of supplements as medications at all. Here's the uncomfortable truth. Herbal supplements are far less regulated than prescription drugs, and many have little to no quality testing for purity, dosage consistency, or interactions with your existing medications. Several herbal supplements have been documented to cause direct kidney toxicity, while others can dangerously interact with blood pressure medications or worsen existing kidney conditions without you realizing it. The danger compounds because most people don't mention supplements to their doctor at all. They'll faithfully report every prescription medication during an appointment, but completely forget to mention the 3 herbal supplements, the daily green tea extract, or the natural joint support powder they've been taking for years, simply because it didn't feel like real medicine. If you take any herbal supplement regularly, and many people watching this do, bring the bottle, or at least the full ingredient list, to your next doctor's appointment. Don't assume natural automatically means safe for your kidneys. Some of the most kidney-damaging substances in medical literature are, technically speaking, completely natural. Let's bring this all together. Number 1. NSAIDs like ibuprofen and naproxen, especially with regular use or dehydration. Number 2. Diuretics or water pills, particularly during illness when fluid loss increases. Number 3. ACE inhibitors and ARBs, generally protective but riskier when combined with dehydration or other kidney-affecting drugs. Number 4. Certain antibiotics, especially aminoglycosides, used for serious infections. Number 5. Long-term proton pump inhibitors, taken for chronic acid reflux far longer than originally intended. Number 6. Statins, in the rare cases involving muscle breakdown. Number 7. Certain antiviral medications, particularly without adequate hydration. Number 8. Contrast dye used in CT scans and imaging procedures. And number 9. Herbal supplements and natural remedies that are rarely reported to your doctor at all. Notice the pattern running through almost every single one of these. Dehydration makes everything worse. Combinations of medications are often riskier than any single drug alone, and your kidneys at 60, 70, or 80 are simply not as forgiving as they were at 30. None of this means panic. It means awareness. Margaret Ellison, the woman we talked about at the beginning of this video, eventually recovered most of her kidney function after months of treatment and careful medication adjustments. But her doctors told her family that a simple conversation years earlier about her combination of medications could have caught the problem long before it became an emergency. So here's what I want you to do after watching this video. Make a complete list of every single thing you take, every prescription, every over-the-counter pill, every supplement, every natural remedy, and bring that full list to your next doctor's appointment. Ask directly. Based on everything on this list, is there anything here that could be putting extra strain on my kidneys? That one conversation, that one piece of paper takes less than 5 minutes and could be the single most important thing you do for your long-term health this year. If this video gave you something worth knowing, do me a favor and hit that subscribe button. We put out videos like this every single week, covering exactly the kind of health information that doesn't always make it into a rushed 15-minute doctor's visit. And if there's a topic you want us to cover next, drop it in the comments below. We read every single one. Before you go, an important reminder. This video is for educational and informational purposes only. It is not medical advice, and it is not a substitute for a consultation with your doctor or pharmacist. Never start, stop, or change any medication based on a YouTube video. Always talk to your healthcare provider first. Every person's situation, medical history, and medication needs are different, and only your doctor has the full picture of your health. Take care of yourselves, take care of those kidneys, and we'll see you in the next one.